926 here, Big 550 KTRS.
There's no way we could talk about what we were talking about offline.
Let's give a shout out to Pat Blassie from Altair Travel and Cruises, who just dropped off a Lubley's Mardi Gras pie for us.
That is so nice.
Mardi Gras pie? A king cake, right?
It's a king cake. Okay, right, sorry.
King Mardi Gras over here knows it.
All right, I apologize, but I saw Lubley's and I got all excited.
Right. You can't even you can't talk when you see Lubley's.
And Mo from Subway dropped off a bunch of sandwiches for us.
Well, that's good because I need some breakfast.
Yeah.
That'll do just fine.
Chad Garrison's here. Ed Martin was here. He went to go get some coffee. Maybe he's looking for some half and half. He'll be here. He'll be back in a second. And Jane Duker. Jane, let's get to the next topic, and that is your good friend Claire McCaskill is throwing bombs from Washington, D.C. What's going on there?
Well, I'm good because I'm glad Mr. Martin walked in because it wouldn't be any fun to have this conversation without him being there.
This
right.
isn't.
Well, it depends on whether you're manly firm, and that's sort of what's important
here. All right,
here.
so what happened here?
Okay, so on the heels of our whole discussion about sexual, whatever permissiveness, and so here we come again. There is a Representative Mike Moon who put forth a resolution calling on our congressional delegation, which includes men and women, to, with all manly firmness, literally, and he put it in quotes, manly firmness, to repeal the Affordable Care Act, and he wants full repeal. I mean, he wants manly firmness until completion, not anytime before then.
I've never even heard that phrase, manly firmness.
Well, it's interesting that you say that. So his defense to this, so obviously a lot of people are like, are you kidding me?
You've been to the Low T Institute.
I have been to the Low T Institute. I mean, that is definitely manly firmness.
I mean, so right.
I think I'm getting uncomfortable at this point.
So anyway,
which is hard to do.
Right. So come to find out that term was used
in a historical document
against the king.
So it's a reference to history.
In the Declaration of Independence, it said, manly
and
firmness.
No one said that the founders were sexist when they were talking about that.
I'm going to finish, mister.
They were saying...
Hold on.
Let me finish here with my rant.
She's filibustering
at this point. So anyway...
Something you would know about.
Nothing about, right.
Intimately.
So anyway, so he says, well, it's in the Declaration of Independence. I mean, even though calling Indians... And Native Americans, savages. That's also in the Declaration.
Yeah, exactly. Language evolves.
We should throw out the Declaration, and we should.
No, I don't think she's saying
that. But
we
don't talk like that in 2015. We don't say manly firmness when talking to female United States senator and female congresswomen. You just don't. And it's this whole 10-year. And, he went on, whatever talk shows and talked about, he has no regrets. He's not changing it. And because it's in the Declaration of it, there are a lot of things in the Declaration in the Constitution that we no longer agree with, such as slavery and things like that. So, as times evolve and you think people evolve, some Missourians don't evolve. But, it's a typical response. And I think this idea of using government to just peddle this tripe, it's getting old. So Senator McCaskill, because she is in the congressional delegation,
she get the whole hour here. Or what
basically said that it's not very manly to cut 200,000 Missourians off of health care. So she sort of slapped him down, right? And so the fact that we have to have this discussion again indicates it's time and time again. It's a culture, and it gets old.
Ed Martin.
Look, Claire McCaskill her persona is that she wants to be on Twitter. She wants to be sort of the people and all. And as she flies around in her jet and her multi-million-dollar home, all this kind of stuff. It's just, this is a silly argument over a resolution that was filed referring to a time in history and using that quote. And McCaskill, let's have a debate about the people on Twitter and other places that say terrible things, like the Democrat, is it Maria Chappelle or whoever was it, told the governor to go somewhere and do something. I mean, look, I just think this is typical Claire McCaskill. She's been with Obama from the beginning as he's destroyed many of the institutions we love, and now she tries to pretend she's somehow aggrieved.
They baited her.
Let's Chad get in here.
It's just outrageous.
They baited her.
Why does he get in? She had 45 minutes.
Well, all right, continue on. I thought you were finished.
Look,
this is so silly.
Let's not say that. Let's not confuse the matter and say that this is just Claire McCaskill who's had issue with this,
right.
So we got the Claire McCaskill photo here. We got
she's
the righteous defender.
She's one of many people statewide who's been
at her. She gets to
appalled
respond.
with this. And what this speaks to, I mean, it's not what's silly here
is knowing history.
It's not.
Knowing history.
What's silly here is all these resolutions that these legislatures are passing that are never going to make any headway, and that are futile.
Right.
And here it is.
I would use the word impotent.
They just cannot get over the fact that Obamacare, Affordable Care Act, has passed.
Neither
and
can
this
Missourians.
is
This is not an issue.
I don't know how many times they've tried to. I mean, this resolution is pointless.
Nobody wants. Missourians, by a large majority, don't want Obamacare. They don't want Obama. But in Missouri, so if your beef is with a resolution about getting rid of Obamacare, that's a different debate. I think that's a good one.
Yeah, but how many times are here's the problem: is that Jefferson City operates. You have all of these good old boy legislatures, mostly white older men who are running this. They have a supermajority. They are able to operate. No.
Are you talking about Jay Nixon?
Able to.
Well, you can make an argument he's part of the problem.
I'm talking about the GOP. I mean, they're able to operate carte blanche. There's no check because they
have a governor that's the check. He vetoes anything we
but
pass.
bringing up these.
This doesn't go to the governor. This resolution
as Jane
never
said,
goes to the
impotent
governor.
resolutions and all these bills. I mean, it's like, and they can go around and they can say stuff like manly firmness that no one would say today. I mean, yeah, maybe people said
he doubled down.
Well,
years
but
ago.
hold on a second. Let's bring a little sanity into this. And it's really the argument has degraded when I'm bringing sanity to an argument, and that is, look, it's a dumb thing to say. It doesn't make any sense. I don't know what he's making a nudge or a nod or a wink to.
It's just a waste of time.
It's a stupid. But the bigger argument is are somebody really going to stand up and take 230,000 people who are paying for their own insurance off of the rolls because this Obamacare, right? Let's stop demagoguing Obamacare because Republicans want people to at least pay for in some way their social contract.
No.
And these are 230,000 people who are paying for their own insurance.
This is exactly what Obama and the left wants, because you're buying into the notion that we're at this moment in history, this is the best we can do. And it's not the best we can do. We should have a better healthcare system. Right now, the healthcare system...
I am all for a better healthcare system.
Forward. I mean, the Republicans aren't going to.
But one of them, we have to get the presidency and a governor that wants... Right, but we need a plan that actually puts patients at the center, not bureaucrats and insurance companies. That's what Obamacare did.
For you all. You've all proposed nothing.
No, that's exactly... So
they're right. Give somebody some other plan.
There are lots of plans, whether it's health savings accounts, whether it's more freedom, changing the tax code to have it so your health insurance is deductible individually as opposed to for your employment. There's all sorts of things. Changing the control. Right now, go out to one of these rural hospitals and ask them when they say it's not Obamacare that they need. What they need is BJC not in charge of the spigot of money that comes in, and the Missouri Hospital Association comes in. This is not a simple problem, guys, but Obamacare is not a solution. It's actually exacerbating a failing healthcare system.
One of the things Obamacare allows is that people who have money, who insurers would not insure. So these are people who were not allowed to buy insurance because insurance companies said they were too much of a risk.
Right.
Those people were then on our public dole when they did get sick.
But that's one solution is to let them buy into a failing system where they're being denied care and being denied access to doctors.
They're not being denied care.
They certainly are.
Oh, absolutely
Go
not.
out to upstate Missouri and find out if they can find a doctor.
Well,
Go to Florida and see if you can get
hospitals.
registered, get in with a doctor.
It's better than it was.
No, but here's the thing: here's another solution. Here's another solution.
Did Mike Moon propose any of these things?
No,
he just comes out with like, just stop it, just get rid of it. I'm getting back to the argument. You're the spin master who's like trying to take it someplace else.
You want to have a debate about Obamacare?
Hold on a second. Let Martin finish for a second.
There is other solutions, including, as I just said, instead of every citizen having to get a job where they get the job employment deductibility for their health insurance, that you get it individually. That would free up a market. And you know who didn't like that? The insurance companies, the big ones, didn't like that.
Well, the insurance companies aren't going away.
But the point is that what happened with Obamacare was an unholy alliance between bureaucrats and the insurance companies.
So you would rather just have a Medicare Part D?
I know. I would
where
rather,
everybody gets prescription drugs over the age of 65.
No. I would rather have a system where people, when they're in need, have access to something like Medicare and Medicaid at a low threshold. But the system needs to change where I'm in control of buying my health care in insurance, and we should advantage that with the tax system we have and other things. That's a real system right now.
People making $8,000 really care about a tax break.
If they have the ability to have
I am
insurance
all for it.
companies
I don't want to
to
have to pay for autism. I don't want to have to pay for oral chemotherapy. I don't want to have to pay for hemp oil. All of those things. Eating disorders. Those things have all been passed by a Republican House and legislature who wants to appeal Obamacare, but then legislate me being forced
I have no
to pay
comment on those mandates. For 10 more days. Give me 10 more
Chad
days.
Garrison, last comment.
Speechless.
I'm just speechless. Yeah.
All right. Speaking of,
Can I just give one Mike Moon quote?
no.
Where he
I have to
filibuster.
talk about manly firmness at the Low T Institute of St. Louis.
Wow.
Because if you want manly firmness,